Welcome back to Lunchtime News. Moving on, health innovators in the Medtech industry have appealed for harmonized regulatory system across the continent to facilitate the use of new health innovation. Speaking during the third Medtech conference in Nairobi, the innovators said that after the lapse of donor funding in the health sector, there is need for homegrown solutions, calling on the government to invest more in local innovations.
There's so many hospitals that don't have equipment. You just go there, you want a scan to be made or a diagnostic service to be done, and they don't have the equipment. So they basically just assess you clinically, and then they give you a diagnosis which is not evidence-based. Challenges that came from first and second conference, one was the issue of regulatory. That when you innovate a medical device, the regulatory approval process is so cumbersome. It's a lengthy process. The other thing we are looking at is the issue of funding. And we're asking ourselves, can we also look at government, one as a purchaser or someone who uptakes or buys these innovations and solutions?
When you bring a new thing, you don't know how it might harm. So when you're doing ethical reviews, there are even no people in this country who might understand the ethics because you don't know what it is, what it may have. So we have shortfalls of how to be able to analyze a new technology ethically, whether it is going to help us, whether it will be bad. And so we have to come as a government body to be able to put policies and regulations that can guide some of these ethical reviews.